Leadership challenges are not novel to the Nigerian Governors Forum. This is the second in a series of leadership challenges that debuted in 2012 with the Nigerian Governors Immunization Leadership Challenge. That challenge was one of the innovative strategies that assisted the Nigerian government to become polio-free.
Nigeria was spotlighted as a country that needed to eradicate polio in the world. I mean, there were just 3-4 countries were involved, and that gave us a pretty bad image. And that was put before the 36 state governors. They adopted the eradication of polio. The challenge started from the center. The Federal Ministry of Health was anchoring this with the minister. And of course, the Bill and Melinda Gates Foundation showed a lot of interest to help eradicate polio. The Immunization Leadership Challenge was part of the package put together by the forum and the experts working with us to help properly address polio eradication.
That leadership challenge was initiated to recognize those governors whose states pass a predefined threshold to improve routine immunization coverage and end polio. The result of which made Nigeria join the leagues of countries certified wild polio-free on August 25, 2020. The success recorded from the immunization challenge through the concerted commitment of the 36 state governors under the umbrella of the Nigeria Governors Forum with support from National Primary Healthcare Development Agency (NPHCDA) and other development partners cannot be overemphasized. It is for this reason that the scope of the Immunization Leadership Challenge was expanded with the aim of strengthening the primary healthcare system in Nigeria.
We have seen how the governors have taken up this challenge, and I hope that at the end of the day, the reports that will be shared will really resonate with the governors, that with the right investments, they can do so much more for primary healthcare. And by investing in primary healthcare, they'll be able to do so much more for their people, because over 70% of their population would actually require primary healthcare. So where else would you want to invest?
Here comes the Primary Healthcare Leadership Challenge. This leadership challenge came out from meetings on human capital development with a focus on primary healthcare. These meetings were convened by Aliko Dangote Foundation, ADF, Bill and Melinda Gates Foundation, BMGF, and the Nigeria Governors Forum, NGF, on the 12th and 13th of November 2019 in Seattle, Washington, USA.
He had gone to Seattle on one of our regular visits with BMGF, and he said, you know what, we should bring some other governors here to hear this exact pitch about why primary healthcare is important and what the governors that had signed the MOUs were at an advantage compared to those who hadn't. So we worked with the Nigerian Governors Forum and identified 10 governors, and we went with them to Seattle. And so we spent 2 days in Seattle learning and hearing about how primary health care could be revamped and changed in Nigeria.
Issues around basic health care provision fund, the commitment to improve PSC financing through that mechanism. So those were part of the recommendation that came from the Seattle, meeting.
And what really started as a seed planted in the conversations that were going on around the table now blossomed into what we now have as a Seattle Declaration, which is really a signpost around the aspirations, the visions of Nigerians for primary health care. What are those things that we must do to get primary health care up and running? What are the things that we must do to strengthen primary health care? This is exactly what the Seattle Declaration was all about.
The Seattle Declaration is summarized into these 7 subheads. PHCUOR. Fully implement the primary healthcare under one roof, PHCUOR per the scorecard. MSP. Develop and implement a fully costed minimum service package which is tailored to states. BHCPF. Fulfill all associated State Basic Healthcare Provision Fund BHCPF requirements. High-level review. Review state PHC performance on a quarterly basis in State Executive Council meetings. Financing. Improve financing for PHC, including per Abuja commitments. Leadership. Conduct regular state task force on PHC meetings chaired by State Deputy Governor. Community engagement. Facilitate the engagement of traditional and religious leaders around PHC.
After the Seattle Declaration, that the governors came back home and there was complete alignment with all the 36 governors around how the Seattle Declaration can really be operationalized until a day when we can actually have the best quality in terms of primary health care. And this is what has really led to discussions around the leadership challenge.
As a deliberate way of measuring success to these commitments and driving commitments to the implementation, a primary healthcare leadership challenge was conceptualized. The aims of this challenge were to maximize governors' commitments, to promote at-scale constructive competition across states, to further human capital development and PHC outcomes. The PHC Leadership Challenge Steering Committee, LCSC, was inaugurated on Thursday, 2nd June 2022 by the Honorable Minister of Health. The LCSC, chaired by the Honorable Minister of Health, with Executive Director, NPHCDA, as alternate chair and the Director General, NGF Secretariat, as co-chair, is responsible for the overall governance and oversight of the implementation of the PHC Leadership Challenge Fund. Other members of the LCSC are the country representatives for BMGF, UNICEF, WHO, UNFPA, the Chair of Development Partners Group Health, and 2 nominees from the Nigeria Health Commissioners Forum, which are the Honorable Commissioners of Health from Ekiti and Yobe states.
There is a partnership in place, the foundation and Aliko Dangote Foundation. We have been partnering with them, but the funding is jointly by the 2 foundations, working through the Nigeria's Governors Forum, National Primary Healthcare Development Agency, and UNICEF as implementing partners. Just to say a little bit about the Challenge Fund, it is designed as a leadership challenge for Nigerian governors, the 36 states, and the intention is to maximize their commitment to primary health care, strengthening in Nigeria. It comes with an annual award to best performing states and most improved states that is made annually. So it's largely, a performance-based incentive for states to really improve on primary health care.
These awards are tended to be used to strengthen and to continue expanding and to continue scaling up the primary health care level.
The fund was launched to ensure transparency in states' assessment. An independent judging panel made up of high-profile citizens was constituted in 2022.
To a large extent, it's been quite transparent. In terms of the assessment, the states were supposed to provide the evidence. So first they should assess themselves, report what they think they have done. They were given the guidelines, so they knew exactly what was being looked out for. So they provide the evidence along the 12 indicators. And the indicators, are supposed to be objectively verifiable, so there must be evidence. And so there was a team of independent verifiers. An agency was recruited, mindset to go around and verify their claims.
The Nigeria Governors Forum signed the Statement of Commitment to be a part of the challenge on 17th August 2022. So, the key messages of this PHC Leadership Challenge are: governance, maximizing commitments to PHCUOR; financing, promoting progressive increase in PHC funding; workforce, ensuring all PHC have requisite human resource; data, instituting the culture of use of evidence for decision-making. Sustainability. Develop a state-led and state-owned LGA-level PHC Leadership Challenge for LGA. From these key messages, governors of the 36 states were to be measured on the following indices: political leadership and community empowerment, financial resource allocation, quality of care, monitoring and evaluation, sustainability.
At the secretariat level, we just ensure that commitments are executed by our principals, the governors. And we have built trust over time. I mean, we have access to a lot of happenings at various places. We equally use different tools here. I mean, there's a scorecard arrangement that puts on the table where you are as a governor or where you are as a state, and then you equally have access to where your colleague is as a state. That is, it's helped to create some kind of rivalry, healthy rivalry amongst governors.
The competition was keenly contested and winners will emerge tonight. This maiden edition of the award night will have 13 awards with cash gift prizes totaling $6.1 million. Here are the award categories. 2 awards per geopolitical zone: Best Performing and Second Best Performing. 1 award overall to the Most Improved and Best Performer. Public and personal recognition from HMOH, Aliko Dangote and Bill Gates.